Hello, everyone. Thank you for joining us today. Today, we're going to cover staffing smarter in hospice. And we're honored for anyone that's joining us live, as well as anyone that will be watching this later. It will be available for use for video after the fact. And the key thing that I want to highlight and that we'll highlight to start off is our main objective today is that we need to create change. We need to innovate. We need to come at hospice and home health with different approaches to reverse some of the trends that we're seeing. Some of the pit in our stomachs around staffing, distill that from a speaker that you'll hear later with Jeanette Dove. We need to band together, and that's really the focus here today. So we hope that we'll interact. We hope to hear from you both in this as well as after. Whether you partner with us or not, we need to band together to innovate together to drive change and elevate the experience for all involved, clinicians, patients, admins, you name it. Everyone that touches that experience needs to improve. So with that, in the spirit of coming together, we'll have some poll questions. We have 3 of them today that we'll provide to the class. Would love your insights and feedback. And then any questions that you have, please share them with us, whether it's in this discussion or a later discussion. We want to hear from you. We want to talk together. We want to, have an open dialogue, open discussion. So I'll move on to the objectives, the actual objectives beyond that. So you'll hear from our 3 amazing speakers today. These 4 objectives: creating flexible models through on-demand staff approaches, reducing operational costs at the cost per call and interaction level, as well as how to achieve peace of mind with staffing needs. And then lastly, how we can utilize and kind of change the interpretation or how we view technology to actually augment the human side of care. That's really what it should do. It should not keep us at an arm's length, but actually, bring us closer to our patients. And so you'll hear from some wonderful hospice innovators in the field, and I'll introduce those here shortly. But we work with 7 of the top 10 home health and hospice agencies in the U.S., large to small. Small one, location, 10 census, 20 census type folk. And what we really do and try and provide is how to scale and grow and how to meet the demands of patients while also enhancing the experience for clinicians. So with that, I will introduce you to our wonderful speakers. So, went too far there. So we'll start with Jeanette Dove. Jeanette Dove has had a 35-year career in hospice and has migrated from spending hours charting and documenting home visits to championing technology and a service platform that will allow a hospice provider to grow their census to 5,000 without expanding headcount. She now helps varied providers with hospice innovation through actionable data, hybrid staffing models, and how to optimize workflows to improve work-life balance for clinicians. We'll also have Laurie Nelson. Laurie guides providers through the process of integrating innovative technologies into their patient care processes, which improve both the patient and the caregiver experience. Prior to her work for CareXM, she worked as an RN in units ranging from ICU to hospice. Hospice work epitomizes her love in terms of care, supporting and empowering those taking their final journey out of this life. Then we'll also hear from our wonderful Christy Fisher, our head of clinical operations. Christy's innovative approach to hospice has helped hundreds of providers with their triage operations. Working for several years as an on-site hospice nurse, Christy has drawn from that experience to drive innovation in triage, transforming the triage experience for patients, for providers, and for clinicians while elevating the experience for all. So to kind of get started here, we in hospice, we're well versed in the challenges Like I said, we work from, some of the largest agencies in the US to the smallest. But there's some commonalities in the challenges that we all face. The sheer demand, I mean, both in numbers of patients as well as in expectations. Expectations have shifted. We now expect, we expect everything faster now. We expect an answer quicker. We expect to be on call all the time, whether it's personally, professionally, or especially in the healthcare setting. And especially now being asked to do more with less with CMS. And so these converging trends, we have an increase in 65 plus in that population. Meanwhile, we have clinicians, as we all well know, leaving this space, and we have a 1.2 million gap over the next 5, 6, 7 years of nurses that we'll need versus what we'll actually have. And so the change has to happen now to reverse these trends. The change has to happen now. And so that's what we'll uncover today, is some solutions that we found from market leaders in the space, from the largest to the mid to the smallest as well, to help them grow and meet these demands. So we'll start with our poll question. Poll question 1 is, what challenge would you rank as your top priority to fix for your organization? Dealing with patient volume, call volatility, reducing operational costs, and reducing clinician burnout and turnover. I'll let Grace, oh, you already have that up. I got 3 screens here, so you'll have to, pardon me here as I try and, make eye contact with a camera. So we'd love to get your feedback here, because we see a lot of these common challenges facing organizations. And so what we try to do is look at it and say, okay, what does a win look like? How do we solve, the bleeding wound to start with? If I'm unfortunately, if I have cancer, but if I'm, drowning in the ocean, I don't really want to hear about my cancer treatment. I want you to throw me a life vest, throw me, something that can help me with my immediate need. But then talk to me about how I can, with my treatment of cancer and what I need to do there. And so we take that prescriptive approach, and have found that works very well with leaders in the space, as well as, the smaller organizations. And so please provide your insights there. Okay, I'm looking at the poll now. I'll give it another 10 seconds. Okay, interesting. So reducing clinician burnout is the clear winner, and then second to that is reducing operational costs. That actually will be a good tease into Christy Fisher later. And then operational yeah, perfect. Okay, well that's kind of what we see typically, is this type of that typically burnout is top priority. We're seeing operational costs, especially with some of the challenges that we have with CMS and the pinch, and then just overall with inflation, being an issue as well, a rising issue. So that very much aligns with what we see typically from our providers and partners. Okay. So what I'm going to talk through here is some of those common challenges that tie into that. So what we typically see is the unscheduled interactions being an issue in terms of what they cause. The unscheduled interactions on their own create a lot of issues with clinician burnout, with what we see from operational costs, because we have the volatility in patient demands that we can't really forecast for perfectly. We can't staff for perfectly. And so, you'll see some insights from our speakers today, talking through how you can create more of an on-demand model to create flexibility. But the unscheduled interactions, I mean, every time that you're seeing, the gap between staff, I'm staffed for this, how do I make this work? When typically I'm staffed here, I'm losing money because I have call volumes that aren't hitting. And when I'm up here, yeah, that's more optimal. But if I have call volumes exceeding this, that's when I'm creating clinician burnout. That's when I'm creating patient despair and frustration. And so we'll uncover some of those things here as we go along. Additionally, triage chaos. So you'll see this. These are some of the workflows that we see. Patient calls in, answering service, goes to voicemail, goes to a nurse, tries to talk back to the EMR, goes back to mobile phone. How does that work within my protocols, patient notes? I mean, so many steps, different applications. How does that all tie together? And that causes, I mean, it's just too many touch points, too many workflows that creates more time and limits bandwidth that leads to burnout. And that's common. I mean, we're all familiar with that. And it's unfortunate because the best intentions are there. It's just how do we bring a different approach? The intent is there, but we need a different approach. And then unfortunately, we've all been in this situation at one time in our lives or another, or will be for that matter. When you're trying to contact a provider and dealing with an emergent situation, it's really hard when you're the patient. It's incredibly hard. I mean, just unreal in terms of how much that time is expanded when it's your loved one. When a loved one is in pain or has a situation that needs medical attention, those minutes feel like hours, and they're the worst experience that you really can feel because you can't control it. Your control is gone. You're waiting to hear back from a provider for guidance, and it's an emergent situation. It's something that could lead to, worse situations or even death. And so those minutes, for me at least, when I've gone through those, I don't wish that upon my worst enemy. And so being able to respond to patients quicker and align them with their provider faster is critical to get rid of the despair or at least mitigate it. So with that, we'll start with objective 1, which will really be around how we have seen providers create flexibility to meet increasing patient demand. That's something that I think we get a lot of questions on, and I'll turn it over to our wonderful Laurie Nelson to uncover some of those strategies and solutions to help with this.
Thanks, Bridger. So I'm not surprised that the poll answer was burnout. As we really think about caring for patients, caring for caregivers, caring for clinicians, our team members, the one thing that is a true statement, and I know I'm being biased here, but if you give a task to a nurse, she's going to figure out how to get it done. It may not be the most efficient, but the end goal will be that her patient is cared for or his caregiver has what they need. And when you're thinking of the hospice and home health, home care in the home space, a lot of times those clinicians get really creative in caring for those needs, because you're kind of a lone wolf out there sometimes trying to figure out how to meet the demands of the patients and caregivers that you're supporting. So when we talk about the burnout, not a surprise that is a number one concern, because there's a lot expected of a nurse heading into a patient's home and taking care of them at such a sacred time in their life, especially in hospice, right? So when we talk about burnout and what's contributing to burnout, I think a lot of times I'm just maybe making some assumptions, some pretty blank statements here, but I think a lot of times we are adding some complex workflows for our nurses in order to get the job done. When I say get the job done, it's not just the patient care. It's really, okay, not only are we caring for the patient, but we have to document that we cared for the patient so that we have evidence that we cared for the patient so we can get reimbursed, and so that Medicare will approve this, that, and the other. And so there's a lot of hoops they jump through. So that burnout is a real thing, right? So part of creating a flexible solution to adapt to your patient's demands and your staff demands is now an essential tool you need to have in your kit in order to be a successful business. You know, when you think of needing 1.2 million nurses in 2030 feels like the future, right? But it's only 7 years away. It's going to be here before we know it. So you got to find a different way to do things better, right? So in order to meet the changing needs, demands of today, you really need to understand what your current workflows are, and you need to understand what your current goals are to accomplish that patient care in order to really identify the gaps in those workflows and gaps in that care that will help you, once you identify those gaps, maybe prevent some burnout or prevent some turnover of your census, of your staff, anything like that. So Bridger described the triage chaos, right? When we talk about just the basic care in answering a phone call. Every interaction we have with our patient starts with a phone call. It doesn't matter where that call comes from, whether it's the referral from a physician, the hospital, a family caregiver needing help during the day, after hours. Really, almost every single interaction starts with a phone call. So let's start with that as an example of how we could create some flexibility in supporting our staff and caring for our patients and caregivers. So a lot of times that complex workflow in answering a call turns into the octopus arms that Bridger showed before, where we've got 6 layers just to document a call and follow up on a patient need. And a lot of times you may have a solution in place, and you may have a piece of technology in place that you feel like was a good idea to start with, but maybe we didn't fully understand where the gaps were to do it. So now we just have lots of layers. So sometimes those layers can be in our people. You saw the layer of having to talk to the receptionist and then maybe leaving a message for the case manager who then had to call the patient back. So it could be in our people, and the layers could be in our technology solutions. We got this super cool phone system, and we have this other cool texting app, and then we have this other really great documentation portal, and then we have our EMR. We have all these different layers. So finding a way to really identify how can we create some flexible solutions using people and solutions to answer these phone calls. And a lot of times in those interactions, we're staffing for the disaster. We're staffing for the worst case scenario. What if they call at midnight and nobody answers the call? Well, I'm going to staff 3 people just in case. You know, what if they call during the daytime and, you know, this is the expectation. So being able to really say, what do we want our operation to look like? How can we identify our current workflow? How can we identify our gaps, and let's fix those so that our solution is smart and it's really automating some of those complex workflows in places they should be automated so it doesn't take away from patient care. So this is an example on the screen here. You know, you've got some basic triage, the way we've always done it. Forward the phone, somebody answers it, a receptionist answers it, we contact our staff, we dispatch them, etc. Or you could do a hybrid solution where we have lots of layers of technology doing the work in the background so that the patient and staff experience is patient focused. And you know, one of the craziest stats for a clinician to really do their job, they spend almost 50% of their time documenting what they did and not giving care. It's documenting what they did in their care. So maybe identifying where we could create some flexibility, some technology solutions that really do that work for them so their care can be patient focused care. Bridger, do you want to go to the next slide here? So in identifying flexibility, you have to figure out a way to do things different. So we call this transformation in our space, right? So when I talk about that example of a phone call, how can we handle that phone call a different way? What if we could really have that patient and caregiver get to the person they want to speak to first, a first call resolution where they need to speak to their nurse because it's an urgent situation, and how can we help them bypass some of those layers to get right to their nurse, focus on the patient care, the nurse is able to really address the need, and everybody is happy and on their way. So first things first, you know, how have we seen providers create flexibility? I think we live in an industry where we have some of the most innovative individuals around, even though they may not get the recognition for that. Nurses are going to find a way to do something. Let's help them find a way to do it better, more efficient, so they can focus on the patient care.
Thank you, Lori. With that, I mean, we'll go through the next poll question. It is interesting, that, especially on the application side. I mean, we're 6 layers deep, but technology shouldn't be that way. It should be something that's 1 layer, ideally, that's talking to each other and automated, as you stated. So great point there. Let me pull this up. Sorry, I got it. So here's the poll question. Poll question 2. What solutions are you currently using to address staffing concerns? Outsourcing to a third party, multiple tech partners apps, investing time and money in recruiting and retention, even more so than what you were doing before, or all the above, which, is an easy answer. So I try and encourage you to do one of the top 3, but we'll give 30 seconds here to answer those questions in the poll. All right. And thanks everyone for your responses. This really is great to see. Thank you. Okay, investing time and money in recruiting and retention is the clear winner. All the above is second. Investing time and money in recruiting and retention, I would guess that's incremental and continue to, be an increasing investment over time here, especially with the converging trends that we're seeing. And that's interesting too, because the more time we're spending in that mode, the less time we're spending on our business, less time, most importantly, we're spending on care. And that'll lead right in a little bit into later on to Jeanette, as well as into Christy. So let me go into the next objective here. Thanks again for your responses. So objective 2. What have you found, Christy, to help providers in reducing their operating costs?
Yes. Hi, everyone. This is a really good question. And I actually was thinking about our first poll, and the 2 top answers were reducing operational costs and then reducing clinician burnout and turnover. And the interesting thing is, if you think about costs when it comes to attrition or to reducing burnout, you usually think of adding more heads, or how do we get more workloads spread out to other people and things like that. So they're kind of like yin and yang, where to reduce operational costs, you have to put more workload on a person, but to reduce burnout, you have to offset that workload, which usually increases operational costs. So the true best answer would be, how do we actually reduce operational costs while reducing clinician burnout and turnover? And that's $1 million question, of course. But a few things that I wanted to kind of call your attention to is to think about what you know and what data you have, and maybe what data you don't have that you maybe could get or invest in. Data is really valuable because it will help lead you to answers and even measure them. We all know about the QAPI initiatives and things like that, but it's important to be able to validate some of the steps you think about and things you're doing, so that you're not reacting on those gut reactions where you're short-staffed and you're doing something just to get by and things like that. But think about a KPI, so a key performance indicator dashboard, as it relates to the interactions with your patients and your caregivers and your case managers. So how many of you have access to how much volume that you're getting at any interval, say every hour in the after hours or something like that? This might seem like, oh yeah, I could pull my report and see what the nurses chart. It might entail that you go into the EMR and see all the notes from last night. Some of you might have a note that's bundled up that tells you this, But really look at that. Look at the delivery of your volume. So Laurie talked about having, every interaction kind of starts with a call. How are these coming in? Ideally, it would be wonderful if the only calls we got in the after hours timeframe were things that were truly unpreventable, like a patient had passed away, or there was a pain crisis or something like that. But we all know that there are often times where there's an urgent refill because a medication wasn't filled in, or the pharmacy ran out of the medications and they only had 24 hours to get it there. And so there wasn't a lot of leeway time, things like that. And then oftentimes it's just patients are calling in because some routine item didn't get taken care of. They're out of their chucks, or, some supply or something. So really having some data and a dashboard that can help you see when your call volumes come in, and then how quickly you're responding. The response to patients and caregivers in this world of technology, they've become less patient. If you work out in the rural areas, they're a little more tolerant of a wait time, whereas sometimes patients expect you to, transport to their homes and be there right away. And that can be really challenging and stressful for the nurses and managers that end up having to deal with this. But bringing it back to the data, what do you have to even measure this so that you can take out those gut reactions and actually make informed decisions and set goals for your team? So thinking about average speed of answer, when a patient calls, how quickly do they get to talk to the nurse or someone that can actually help them to solve their problem? That's one way I would encourage you to really find ways to reduce your costs by actually seeing what those data points are. Then you can make decisions around staffing. Typically as the office closes, that's usually where the spike and the busy times are in the after hours calls. So maybe it's a change in staff, or have flexible staffing where somebody stays an hour later to help take care of those calls, instead of sending those all to the nurse. It creates burnout and then attrition and things like that. Another thing you can do to really drive down costs is to get into preventing calls. Bridger, if you go to the next slide, looking at how and what types of calls are coming in. If you're getting a lot of calls that are related to medication refills, or where's my nurse at? What's going on? Those types of things, those are preventable. Those are things that can definitely be taken care of. Equipment orders and all those different things. But do you actually know and have the data that tells you this? Or is it very manual where you'd have to go and look at each of those? So kind of consider for a moment the systems and the technology that you currently use and what could help you actually identify this. Once you identify it, your QAPI teams will love you, because it's data right at your fingertips to say, hey, we're having a lot of calls for medication refills. If we make an initiative where we have the case managers do XYZ, maybe they tuck their patients in on a Friday, or we have some other sort of initiative, and then you can track that those are reducing. That not only saves money because it's less calls that you have to do, and you have those unscheduled interactions in the green, you can staff a little bit lower. Then you can reduce calls, which is savings, but also the bigger savings is that burnout savings. If you've ever been a nurse after hours and you've had a long day, maybe you've had a pain crisis, you've had a patient that passed away that went faster and the family was struggling, and then you get 2 calls where it's, hey, I need you to deliver some supplies, or I need to get a medication refill, and it happens to be the Roxanol, so that they are now having to figure out the pharmacy and the physician to get that ordered and get it delivered stat, and you're worried about that pain crisis when all it would have taken was somebody that had checked in on them the night before. So things like that. But if you really get into those types of calls, you can actually work on preventing them, and you can work on reducing that burnout. So it's kind of that hits both sides of the story to really put it where it matters. And, a third bonus is then you also have patients that have better satisfaction because they don't even have to call in the first place. It's not even an issue. They've they've kind of escaped a problem, and the less problems they have, better satisfaction, the better care, and all that sort of thing. So really looking at your operational costs, you have to know what your staffing levels are and what's actually going on in the after hours or even during your daytime hours, to see what your people are doing and have a really good idea of what the workload is. And that's really hard to do unless you have some sort of a insight or monitoring or data point that you can point to. Bridger, you're on mute.
Thank you. The key question here, we'll move on. Thank you, Christy. The key question is, how do we get rid of the pit in our stomach? How do we achieve peace of mind and staffing while we scale? We all are there to an extent in terms of waking up in the middle of the night, with staffing on our minds. So I'll introduce Jeanette Dove here to uncover some of the strategies there to help achieve peace of mind.
Thank you, Bridger. Oh, you give me the hard part, getting peace of mind, especially when you hear everything that Christy and Lori have been talking about. It does put that knot in the pit of your stomach, and how do we alleviate that? Especially when you're trying to grow as an organization and make sure your staff is happy and meet your patient and family's needs. But when we were operating lean at Bristol and we were going through the pandemic, as we all have, I kept a saying in mind that it's not the strongest who wins in life, but it's the most nimble, the most flexible, and the most adaptive ones that win. And so those words, nimble, flexible, and adaptive, really drilled home with me as we began looking at our staffing journey and how to achieve a target answer to our staffing chaos. And we began to think about organizational practices and the needs of our workforce in a broader sense. And we had a team that engaged in a multi-department initiative that was charged with reimagining strategies and designing strategies to attract the best and the finest recruits, and to invent practices and programs to retain them. So it took a creative partnership with not only the leadership, but all of our staff and all of our business partners to bring some peace and innovation to our staffing model. And during this organizational initiative, we worked under 4 premises that guided our planning. And I'm going to share those today for your consideration. The first principle was target the patient experience. Listen to your patient. And the pandemic forced this hyperspeed shift in how, when, and where our employees want to work. They were looking at that. So we had to consider the fluidity and the continuity of the care experience that we deliver to our patients and families. And we asked the question, who, where, what, when, and how are our patients being served within our 24/7 environment? Because we wanted to get at the heart of the overall perception of care from both our patient and family and our clinicians. The second premise we worked under was target the clinician experience. In other words, listen to our clinicians. We analyzed and adapted to the demands of our workforce by creating flexible work opportunities, flexible training, focused reskilling, and at the same time, we worked at the forefront of technology utilization and innovation to benefit our clinicians. So we listened to our clinicians. And the third premise was look for technology partners, not just vendors. So we were very curious and engaging with our established and emerging technology partners. It was vital that we were highly involved in their product development, and we were very verbal about our needs and our expectation of our technology partners. And our fourth approach to this was look for communication platforms. As Christy and Lori talked about early, not using a patchwork of applications, but in other words, using a technology platform that communicated with other technology platforms. In other words, did they talk to each other and gather data in a concise way so we could listen to our data and use it. With platforms that communicated, we were able to economize on the clinician's time, and this resulted in more time at the patient's bedside. We also used it to mine data for patterns and predictive indicators from multiple sources that encouraged our thoughts and our innovation and our flexibility in developing staffing models. We became alert and knowledgeable about the capabilities of our technologies, and we actively worked to improve performance and develop creative solutions with our partners. And one thing I'd like for you to remember about your data and your platform partners is your answers to your needs are hiding in your data. You've just got to mine it and analyze it and then use it to improve and develop your new processes, your new approaches to staffing, and really listening to that information that your patient and families are giving and your clinicians are giving and all of your technology partners are giving you. We found that this four-pronged premise approach guided us in developing a customized piece that helped our staff and it helped our leaders and all of the patients' families that we served. I like to think it gave us a little bit of peace in the chaos that we were all going through and we continue to go through. But in the end, we found that the approach resulted in a simple equation that we all know. Patient satisfaction and employee satisfaction creates positive outcomes for all of us. And I'd like to encourage you just to remember, it's not the biggest and the strongest that wins. It's the most nimble, the most flexible, and the most adaptive group that wins in this fight we have in our staffing. So that's some points from me, Trim, for everybody.
Love it, Jeanette. Thank you. And, we can highlight some of the results that you've seen. We highlighted that a little bit earlier, but I mean, wonderful job at Bristol, just the growth and how you're able to scale, 5X in census while reducing that call volume per patient. I mean, that's incredible. And that's one of the many, use cases that, we hope to provide as well as just, learn from. And share, because like we said earlier, we're all in this together.
Yeah, and that four-pronged approach resulted in these outcomes that you're showing here, Bridger. So
love this, Jeanette. That's great. On that, that results, it's getting rid of that. That's a pit and stomach if I've ever seen one. I tried to find pit and stomach images, and I thought that was the best one. That was one of the first ones that popped up. And then in addition, to hit on your point there, Jeanette, I think the business flexibility, just overall, any business for that matter, it's not the big that eat the small, but the fast that eat the slow. And that's a book, by the way. So hopefully that's not a trademark issue, but love that book. Encourage you guys to read it. But especially in this space, we need to be nimble and on our toes. And Jeanette, I'll turn it back to you on this one here. In terms of this quote, I'd love for you to share that.
Right. This is what we pivoted off of. It's not the strongest person who wins in life, but it's the most nimble, flexible, and adaptive person who wins. And that's a quote that we lived by, and it works. And it's definitely one that you can think about when you wake up in the middle of the night and worry about your staffing. Just got to be nimble, flexible, and adaptive. And we can all do that. Absolutely.
So that could be kind of like our meditation to help us just go right back to
Right.
sleep, right?
Right.
Love it. Thank you, Jeanette.
Uh-huh.
All right. That leads us to our final poll question. And again, really appreciate your responses. So poll question 3 is: many providers have already invested in technology, but find there is now too many layers. Is this an issue for your organization? And it's just a simple yes or no. Would love your feedback there. And then if anyone has anything to add while we're waiting for the poll results, please do so. And then we'll move on to our final objective. One takeaway that I have from this discussion is getting surveys out more so. We discussed this a little bit, and Jeanette, you talked about this, I believe, yesterday. I think we could do a better job across the board in terms of gathering more insights from providers, from clinicians, into pain points, as well as how we can try and address them, and learn together. So I think that coming out of this, that would be a very wise action item. And kudos to you, Jeanette, for that idea. Okay, poll results kind of split. Yes is barely winning. So that's interesting. That's actually good. And that's really the goal overall for us and for any company that kind of brings in the service side as well as the technology side, is how do we automate as much as possible and have these different applications speaking to each other. So if you do have all the ones like you were highlighting, Christy and Laurie, in terms of Laurie, you were saying like a cool text feature and this other feature, then you have your EMR, EHR. How do they all talk to each other to make sure that patient notes are succinct, that they go across the board, that everything's HIPAA compliant? And then the more we can reduce those layers, the more it saves money as well on the operations side and what you're investing in from a technology perspective. So thanks again for that feedback.
And I was just thinking too, the more you have technology, you can go ahead and go to the next question if you want, Roger. Say the more you have technology, the more reports you have. So there's another layer, and back to Jeanette's point, you have to mine your data. It's great to have data and it's great to have all of these reports, but are you really mining the data so that the reporting is useful so that you can then make better business decisions? For sure.
Agreed. That's a great point, Laurie. So we'll move to the last one, objective 4, which is really open for the speakers as well as for the audience. How do we utilize technology to augment the human side of care? I'll kind of leave that open for whoever wants to jump in.
I think one of the most important things when we think about who we're servicing and what we're doing, we live in a world full of technology. So being on the side of we can't use technology because the people we're serving don't use technology, I think that's now a false statement. I think regardless of almost anybody's age, they use technology. So there has to be a bit of a mindset shift that, yes, you may be dealing with an older population, but they use technology. My dad is getting up in years. He's almost 80 and he is on the family group me and he uses Facebook, he uses technology. So I think that old belief that utilizing technology takes away from the human side is now a false statement. So it's really implementing and utilizing technology in the right places so you don't feel like you're talking to a robot to get patient care. But not all technology takes away from that care that we all want to deliver.
Yeah.
Laurie, I would agree. I think it's almost expected now. Technology is expected in, a patient's life that's been through the medical field for a while and been to their physicians and maybe the ER or something. Technology is almost expected to be part of our care delivery.
It's interesting. You think, where we've come from just in the last 20, 30 years in technology, it's magical in a lot of ways, especially for people who don't understand how it works. But the best part about technology and when it's used correctly is it is magic. It just happens, but it doesn't become the focal point. So, for example, if you're a nurse and you're working telephonically, you want the technology to work. You don't want to focus on how to work the phone or the text. You just want to see the data so your mind is focused on the patient. And I think as we look at technology and looking at the human side of care, do you have technology that's becoming more frustrating, that's creating frustrations or even burnout because they're so tired of dealing with it? Or do you have technology that's making that quicker so that they can actually focus on the patient more? And that's really important to consider.
Great point, Christy. Well, and I think on that side, I mean, as we're dealing with just the patient volume and demands, we're asking, like you guys were saying, we keep almost overcommitting to our clinicians. And like you said, Laurie, if you ask a nurse to do something, he or she will figure out how to get it done. And the technology really should ideally allow us to do one thing at once, which is focus on one patient at a time, and connect with that patient at a deeper level versus trying to be on call while also with the patient at the same time in the home or whatever it may be. That connection should be supported very much by technology.
Yeah, I would agree, and just add that our training of our staff and education of our caregivers about what to expect from our technology is also important as we go through the process of caring for them.
Agreed. That's a great point. Anything else to add? We can move to the Q&A side if you like. Good to go? Ready for some questions?
Do it. Let's do some
Okay.
questions.
Pop quiz time. Laurie seems like she's ready to take the first one. She's excited. Okay. So let me look at the questions here. So let's see. Do you feel the results you had at Bristol, I guess this is for you, Jeanette, are possible in today's environment?
Oh, definitely. We talked a little bit about the results we had working in partnership with you guys and our other technology partners. It definitely is. I think it's just important for the leadership team to communicate with staff and listen to staff, what their needs are, what their wants are in delivering care through technology. And I think that is the true key to it. Listening and being open, and then communicating that with your partners, and including patient and families too. Sometimes we focus on the clinician and what the clinician is telling us about their needs to deliver care, but we have to really also engage with our patients and families and listen to them and take their needs back to the leadership table, to the executive table, and say, this is what our patient and families are telling us they need. And maybe it's through the CAP survey, and maybe it's through individual surveys that you may customize in your company. But I think listening and then taking that and integrating that into your technology solutions and processes, I would say it's definitely achievable for organizations.
And I would 100% agree with that, as we love Jeanette and Bristol, but they weren't a one-off. They are a perfect pioneer in this space of doing triage different and utilizing their data to make improvements in their day-to-day business. But it's been a repeatable situation that is, you really do something different and you really take a good look at all of the aspects of whatever you're trying to accomplish. So, Jeanette, you have to have your staff's voice, right? You then have to have finances input, that you then have to have a technology layer. Like, all of those things matter in making these decisions, and all of those things matter in being accountable for making movement in or progress in whatever goal you're trying to achieve. So Bristol is definitely a pioneer in this space, but it's a repeatable opportunity for anybody who's willing to do something different. Use your data, mine it, implement it, make progress, make change.
That's I love that. Both. Thank you for that. And then one thing to add too, I mean, just the overall trend, the people that are doing this right, that are fast, that are nimble, that are listening to the voices of their patient and clinicians, they're the ones that are going to win. I think in this space long term. We're seeing the growing trend just overall of patients. They're not just looking at their referrals, they're Googling you, they're looking you up on social media. And if you make it a great experience for the caregivers, the loved ones around the family or the patient themselves, those are going to be the ones that win, because the patient's more educated than ever before now in terms of your quality of care, not just in the CAP scores, but also what they can see readily available online. Okay. Next question. Let's see. How hard is it to upload your software and services? Can you start taking calls like immediately?
I'll take that one.
Okay.
I'm like, Christine, let you answer it. I'm going to take that one. When it comes to any change in your business, as much as you want to have it be, you know, you pull it out of the box and start using it. If you really want to make change, there is change management involved. So when it comes to the actual implementation of the software and using it, very, very easy. But if you're just putting a Band-Aid over the pain, you're still going to have some symptoms of the cause of the pain. So when we talk about, you know, partnering and how easy is it to make a change, it's a little painful because we're getting to the heart of the problem, but the software itself is really easy to use. As we partner alongside you, we really want you to have the most positive experience to see growth. So there's some change management that could be painful, but not so hard that you can't make the change, for sure.
And I'd like to add, Lori and Christy, that the CareXM team is amazing in helping you manage that change. They're supportive, they're hand in hand with you. Sometimes I use a slide picture of professionals walking down a hallway kind of linked together. And that's the way I felt and my team felt with the CareXM team. They didn't just give it to you and walk away. They're involved in your change management, not on day 1 or day 10 or day 30, but every day of the year, they're there with you. And that was really what I found that allowed Bristol to have such success in this area.
Yeah. And the interesting thing with, as you implement things continue to evolve, ideas come, and I loved being partners with Bristol and other clients where we have found other opportunities to continue to evolve and improve. So I really like the idea where we're not vendors, we're partners. You know, in my world where I have some of the triage team that may be taking some of the overflow if a client's nurse is busy or something like that, it's a cumulative. We both want what's best for the patient, and we want to provide services and easy technology so that, again, the technology isn't at the forefront. It's in the back of your mind because we're focused on the patient, and together we kind of pull that together. So it's fun to evolve as things have gone through and made things happen.
Great. Thanks, Chrissy. Let's see. I don't see any more. Well, one more. Usually outsourcing increases cost. Do your customers really see results? Your partners really see results and lower and improve operations?
I'll take this one up first stab, then Laura, if you have any other feedback, but yeah, they do. Interestingly enough, you know, if you look at just outsourcing, is it a cost? Yes, but it's an investment, and investments always bring returns. And so looking at the returns, we've seen clients that have been able to just look at their FTE counts, because maybe if you remember that staffing model and you're staffing for the worst case scenario, maybe they can reallocate a nurse. They had 4 nurses, maybe they can actually work with 2 nurses, and then they can use the technology and use services or outsource services that can back them up at those peak times only. So that's a big way they can reduce costs, but costs aren't always in dollars either. You know, you talk about costs associated with attrition that are dollars, but it's the burnout, the feeling of being on call, or the feeling of being alone in the field. If you're the only nurse on call and you're on for 7 days and you've got some major things going on with patients, there's the partnership with other nurses that you can bounce ideas off of. You can have some partnerships with to not feel alone. And that right there talks to attrition, and it talks to burnout and that satisfaction with jobs and security. And so definitely, whether you're looking at dollars or you're looking at burnout, there's savings in both ends.
I would say in my early days of understanding how to really run a triage center, a lot of your business decisions are emotional. The phone call always has to be answered. I need somebody on the phone, and, I'm getting complaints from my nurses that they're busy, but I don't have data to support it. So when you think of really utilizing a software that gives you complete visibility into what your team is doing, your business decisions are better. So for example, maybe you're staffing today, your cost per call is $85 because of the staff that you have on at that time. And they're getting 3 phone calls and there's 2 nurses staff to take those 3 phone calls. That's costing me $85 a call. Well, that's a lot of money per call. And when you think of really understanding your call volume and when you need to staff more, when you need to have 2 versus 1, and, maybe I need 2.2 employees, but I can't hire 0.2, so I'm hiring 3. Those are all costs. They're inflated costs to take those calls. So understanding your data and understanding a good opportunity to do it a little different. Hybrid solution, maybe you outsource for 3 hours a night to back up your team versus, doing it all on your own. So doing things a different way and understanding your data will definitely help you save money. And I remember in my very first experience, there were about 14 employees. And when I looked at my cost per call staffing the call volume, I was like, oh, no wonder it's not as profitable as it could be. Being able to really allocate staff to do the right care at the right time definitely is, one, a money saver because you have people doing the right thing, but also 2, back to Christy's comments and, Jeanette's about turnover and attrition. Well, if I'm giving them the right amount of work at the right time, they're going to be a lot happier. And then if I'm giving them loads of work that is creating a lot of stress just because I'm trying to save costs. So there's definitely some dollar savings in staffing appropriately for sure.
Perfect. Awesome. Okay. Let's see. I don't see any other questions. So with that, if anyone has anything to add, we'll end with 3 minutes early. Give everyone back 3 minutes.
Hey, thank you for joining today. We really appreciate your time.
Yes. Thanks everyone. Thanks
Thank
for your
you.
engagement and joining today.